So it's my turn. Jim Burns, as she said, and I don't want to talk about my bio. I'm a Yankee fan. That was supposed to be on there.
Red Sox fan here.
But thank you for inviting me to this wonderful group. I can see that you're all kindred spirits when it comes to being advocates for youth. My job is adolescent medicine specialist, and I work with the residency training program, teaching interns and residents and medical students about the adolescent medicine, adolescent patient, and being the only specialist in this area, I get to see a lot of teenagers. And my over 30 years I've been doing this, and so every visit I have, to the chagrin of my manager, I go through screening questions related to adolescent health. And I use a mnemonic HEADS. Did anyone ever hear what that is besides Kristen, who's the med student working with me this month? Yeah, and of course I've had the privilege of working with Bree and Rena Nord, who are one of you, and who have been very talented additions to my practice. So my job involves getting to know the team, trying to be cool, which is not my nature, and just being myself and realizing I'm not a teenager, and basically screening for problems. And the HEADS assessment is a structured clinical kind of interview, and it's a mnemonic. In H-E-A, actually it's two E's, A-D-S-S-S. So HEADS, and people keep putting additional letters on, and so it's getting a little out of hand. So the H stands for home, and what's good about this screening tool is it does identify the ACEs in the teens and the consequences of the ACEs. So you look for the home situation, and I usually do this with the parent out of the room. This way I get a confidential interview and ask how things going at home. And, you know, are they safe? Is there, do they get along with everyone? Are there problems with violence or abuse? And I've been surprised, even every day I'm surprised over the last 30 years, even though I've been doing it, that I do find quite a bit of that as a problem. And then, of course, the E for education, how they're doing in school. Schools are so important in our youth. And are there bullies? And I didn't see bullying there specifically as an adverse childhood event, but I think we should make an amendment and put bullying down as a serious adverse event. It certainly affects teens in a very negative way. And it's important to identify that, I find. Asking about their behaviors in school, they're being suspended, and unfortunately, I have to ask if they've been arrested, and find that there are a lot of kids. Someone mentioned schools to prisons or pipeline to prisons, and I find that a lot of our youth in our clinics, mainly Medicaid, are getting arrested, and they're getting arrested for things that I don't think are that serious, in my opinion. So, you know, we can do better on that. The next is the A, and you know, this is nice, isn't it? It's nice, easy way to remember things when you're like looking at the teen, and it's always like the first date when I get in the room with the teen, like they're not saying anything, so I got to start talking, you know. And so the A for activities, and it's always good to see, you know, are they involved with sports and scouts and church groups? Are they in gangs hanging out on the street corner? It tells you a lot about what's happening in their lives. And after A is D. So D would stand for any history of drugs, alcohol, tobacco, marijuana. I even use the word weed because that's the most common drug, and they'll kind of laugh when my old man mentions the word weed. But be surprised again how much our kids are involved. And then S's, there are 3 S's. Suicide is a good thing to screen for. The American Academy of Pediatrics now has come up with a statement that we should be screening for adolescent suicide. It's the 3rd most common cause of death. And with its, of course, underlying pinnings in depression frequently, we ask about that as well, and anxiety. S, again, sexual activity. We see that the kids are more likely to have multiple sexual partners if they've been through adverse childhood events. And of course, I always ask is, you know, we have to check the pregnancy test. And I'm always amazed, you know, I've had people come in, teens who just routine physicals, and it's amazing what we uncover, you know, a 6-month pregnant uterus, all right? And they either didn't know or didn't want to tell anybody, all right? And of course, I see the STDs. And then another S is safety, we'll say, or savagery would be how much abuse is there. And I do find it, and I have to report it, of course. And so all my colleagues know if there's a police car out at the front of the clinic, it's just me doing my job. So it's not a funny thing, but in a way it's true. We have a lot of cases to report. So I guess what have I learned over these 30 years? Well, a good parent is going to provide love and limits to their kid. And I think another quote that I've heard, and I'm sure you've already heard, is that kids spell love T-I-M-E. And I'm inspired by the movie, of course. It does give me a nice way to index and correlate all the things that I see in my clinic. I think I'm also inspired by the many adult figures in teens' lives, and of course you all, my good colleagues, Bree and Rena, are fabulous talents in our clinic and working with the teens and bringing out these events and working to address them. But you know, we also have members of the community. We have coaches and clergy and teachers. And just think back on your own adolescence, who's influenced you. And it becomes a community effort, doesn't it? I worry that we've become too involved in media and television, and we really haven't had a chance to really work as a community in helping our kids. You know, they're just out there. Everyone, even in the office, when I try to get a history, the mother and the teen are like tapping on their phones, and it's like, come on, let's connect as humans. Let's not do that anymore. So, but I am inspired, and I see some of the bleak futures turned into bright ones by people like yourselves, who are dedicated and interested in the well-being of our youth. So I probably got over the 5. Thank you so much for inviting me, and look forward to any questions you might have.